So Sarman is back. There were months of extreme trauma. There was a time where he didn't know what was going to happen to his family, but he's back. We all, as responsible individuals, have to take heart that not only him, but a decent number of people are back at work. But if we stop there, and if we stop getting our concern stops there, it will be disastrous, because we have to remember that hardworking women and men who saved for future of their children, who worked multiple shifts to make ends meet through honest incomes, are now dependent on donations. Some of them have been able to come back like Sarman, but a lot of them are still dependent on free meals and cash distributions. It has eroded years of savings and self-esteem. As we rebuild and as we plan, it is important to take cognizance of what has been lost by this constituency. And if I have to segue now to the next conversation for which my friends have now joined me, I want to place a thought again as someone who lives in an urban area, and who is at the receiving end and who has really benefited from the services that we have enjoyed from the various people who work for us, also the migrants. We are at the receiving end, and which is the destination for migrants, and therefore there is a danger of viewing them just through one dimension, that of people who work as daily wagers or who provide a service. If we shift the lens and think of the location or the source from which they come, we can begin to comprehend the complexities that cause them to migrate in the first place. To carry this conversation forward, we requested the three friends who've joined us, these wonderful leaders who I have had the privilege of knowing for a couple of years now. And I would like to introduce to you Pallavi Sobti Rajpal, who is Deputy CEO of this fantastic organization called Utthan that works in tribal and coastal region of Gujarat. Mina, who leads Nishtha. That's an organization, fantastic one at that works in extremely difficult realities of 24 Pargana, West Bengal. And Dr. Prakash Tyagi, who leads GRAVIS, again, awe-inspiring work of over decades in extremely tough conditions based in the Thar Desert of Rajasthan. The whole purpose of inviting these three wonderful people for a joint conversation is to bring out the importance of the context of individuals to the problems that they're facing. And without me going on, I want to actually begin with Gujarat and Utthan. While Salman gave us an idea of migrants' lives from, due to interstate migration, what Utthan brings is a lens on the intrastate migration, which is where people travel maybe 20, 30 kilometers a day. Maybe they're not even called migrants in that case, but there's a lot of complexity that lens brings. And Pallavi, with that, I want to welcome you to this conversation. Extremely grateful really to have you here.
Thank you.
But quickly from you, the context, the observations that you would like to share from your location with us.
Yes, thank you so much for this opportunity. Like we said, we have been working with interstate migrants. So I'd like to add to what Naghma said. Apart from the shorter distance migration, we have inter-district migration within Gujarat as well. So the tribal pockets where we work, communities typically are migrating for working in the agriculture and the construction sector, and they do migrate for about 6 months a year. And currently, if we see our observations are that even in July, a study which we did as part of Rapid Rural Community Response to COVID-19, a network of 60 organizations in the country today, we observed that even today, 66% households are saying that there is lack of money for food, which is like the most basic thing. We started off, even when we started in April, that was the situation. And even today, 66% is not small. When we talk of losing migrant incomes, what you spoke about, Naghma, earlier, that there has been a huge setback. And even today in July, around 42% people are saying that they're not sure when they'll be able to go back. Because let us remember, these are communities who really depend a lot on migrant income. And even today, like our latest field reports, which our excellent team working on the ground continuously is, working with the communities and understanding with the leaders, is that yeah, about 70% migrants, the interest migrants too have moved back, gone back to try and find some work, but they are also still facing several issues. One, there is lesser number of days of work which they get. Pehle,
Right.
what they used to get was about a week continuous work, and now it's about 50%. The wage rates are lower. There is very strict monitoring by the contractors.
Right.
The hours have become slightly longer. So, and along with this, when we talk of the daily wage workers, which you spoke about, typically in the coastal districts where we work, they migrate. I mean, now we would say what whether that's migration or not. But I move, travel almost 15 to 30 kilometers every day to work in the construction or in the agriculture industry in the towns of Bhavnagar district. So even these daily wage workers have slowly gotten back to work in some ways, but the construction industry is very low, and they face the similar issues of
Yeah.
lesser days, lower wage rates. So
Yeah.
that's
So,
all in all. And another important data which we saw was 66% families, Nagma, are still saying that they are fearing. There's fear, there's anxiety, and they don't know how they will sustain their income. And they're continuously talking
yeah.
about this.
Yeah,
Yeah.
yeah. No, I was actually going to ask you just that. That what I'm hearing really is there is a real fear of even the next meal on the table, and
Yeah.
income security along with food security are huge burdens on the on people's minds. Within communities that probably were living in a certain way, this could also have some social. There is a response that also happens, right? Because there is a lot of upset, angry people that are there.
Yes. There is, there is fear, there is anxiety, there have been mixed responses. But in our experience, the communities we worked with, they have really come together. And it
Yeah.
is the village way of life, or little more than, of course, the urban way of life. People do come together. There is a
G.
great deal of sensitivity in, how we can ally to, improve the situation. But again, when the resources are limited, the challenges are so difficult. So there is a tendency for, conflicts to arise.
Yeah,
So
but
we started, trying to address the situation. Yeah, please tell me.
no, no. I was actually going to ask you the same question. What then has
Yeah,
the
so what I was trying.
community done together? Yes.
Yeah, so basically, wherever we've been working, the Utthan's core strategy is to develop and capacitate people's institutions. So we support 4 district women's federations, which comprise a large number of women, 2,000, 3,000 women. Along with that, there are several village level institutions we promote for any activity or any kind of issue we try to work on. The key is to bring together a group of people and build a capacity as an institution, so that in times like this, and this is what we really saw, that these institutions which we had provided inputs to over long period of time, these are the institutions which really came up. The mahila
Yeah.
sangatans, the village development committees comprising of men and women, the panchayats whom we, sometimes there are conflicts also, but a lot of people who are very sensitive, the work which we did with them in the past time really helped tide over some of the difficulties which the most vulnerable communities were facing. So the sangatans actually really identified people who really were in need of food right at the start.
Hmm.
And on the other side, the situation was basically that people were unable to sell their rabi produce.
Hmm.
So they also identified, along with the village development communities, women farmers who were finding it difficult to sell their goods, especially single women who didn't
Hmm.
even know how they would reach the APMC. There was no clarity. Then nobody knows nothing about the MSP. So we tried to combine these two, especially in our relief work. So we sourced the grains from the women farmers, and youth, women from the panchayat, we put them into food kits along with several other items.
Hmm.
And with all safety practices, we made them available for the most vulnerable at the village
Yeah.
level.
So basically,
So
what
we've
I'm
tried to reach
hearing.
out to about 3,600 such families.
Wow. So what I'm hearing, Pallavi, is here is where the different members of the community really came together, identified the most vulnerable. The men and women really
Yeah.
worked, whether it's Mahila federations or village committees. They worked together, and on a pooling system of sorts, help
Yes.
address the needs of the extremely deprived. And that's because
Yes.
the community decided that it will work together. This is really what I'm from
Absolutely.
you, right? That's quite brilliant. And going forward, Utthan has a plan of leveraging on this. Is there more? Because we do understand that it's a period of where everything has still not settled. Is there anything that you envisage which will work very well given the amount of planning you're doing right now, or it's just going to be building on this federation collaborative and moving on from there?
Yes. So along, I mean, the very strong field team of Utthan, the this model which we demonstrated even during our relief work of a people to people social solidarity enterprise model, we are basically the model really brought out that what we need to strengthen is local supply chains, and which is what women are saying. Okay, why
Yeah,
should we
yeah,
have to depend on why should the crop we grow, why should it not this that crop be available in the PDS? अगर हमको
G.
मकई खाना है, मेरे को जो मकई पसंद है वो मैं जो मीठा मकई उगाती हूँ मुझे वही चाहिए. Why should I get
G.
something else? So
I get
and
you. Yeah,
this is apply to all goods we are talking about.
yeah,
So this is one thing we're trying to really see that what are the ways in which we can strengthen local supply chains, how we can do some kind of collective livelihood
yeah,
initiatives so that at least to start with the we can maybe not arrest but to begin with at least reduce number of these migration and move forward, of course.
yeah,
And one thing which we really see is that we really need to continue to invest and our time and energies and resources in strengthening people's institutions
yeah,
and support communities to really access basic entitlements and
yeah,
reliefs announced by the government. Because even the data, I mean, I'm not going to give too much detail, but there is still a lot to be done even
yeah,
in the Jandhan accounts. We hum baat kare, yeah, we talk about the the agriculture related reliefs. There is lot of
yeah.
gap. So
And
if
we have to
there
bridge
is a
it.
announcement.
Hmm.
Yes, yes. And in all of this, there will be surely a need, because we are talking about bringing back dignity and livelihood. But within this, it is really very going to be crucially important to also look at women, at girls, at communities, and overall communities facing discrimination due to caste, class, and religion,
Yeah.
and really see how we can,
Come back
bring
together,
back these
really.
communities. Yes, because we must remember these were already communities who were facing, different kinds of vulnerabilities, and this has added another
Yeah.
huge layer.
Thank you.
And for all of this, I'd like to just add one important thing for this. It's really important that the government and the civil society really need to come
Hmm.
together. We need to trust, trust, trust.
Yeah.
So I think we need
No
to
substitute
strengthen
for
those
trust.
partnerships, and we all need to come together in this crisis to see how we can, strengthen a lot of the issues we had already been raising for so long. We all
Yeah.
know that
Yeah.
sustainability has to be the key. So can we just all get back to it and work together?
And solve. No, thank you. Thank you.
Yeah,
That's really brilliant, and you left us really thinking about. There's no substitute to trust, really, as we navigate probably
yeah,
one of the most difficult times that we've
absolutely.
got. And with that, I want to really move over to invite Dr. Prakash into this conversation. And even in the absence of COVID, Dr. Prakash, the entire team of EdelGive, I clearly remember you've always spoken about the need to understand the realities and the context of Thar Desert, and and the fact that we must appreciate the difference that the geography brings to the lives of those people, and how it is different, and we have to appreciate this difference to be able to bring meaningful solutions. But given all of that, during COVID times, I mean, would you just kind of take us through a little bit of what you saw and what kind of effect it had in your area?
Yes, thank you very much for having me in this conversation. It's always a great honor to be in EDGE. And it's really good to be in this important panel discussion that focuses on livelihoods affected by COVID-19. As you just introduced me, Thar Desert is a vast area, and some would not know that Thar Desert is the most densely populated desert ecosystem, not only in India, but worldwide. So this is the desert that really matters. A large number of people live here amid droughts, food insecurity, poverty. And COVID-19, of course, has made big impacts to existing problems to the area. Our organization, GRAVIS, works in the most remote parts of the Thar Desert, and we have been working for a long time. And since the very beginning of the pandemic, we have been interacting with the local communities, gathering evidence, developing collective strategies. I would like to begin with a couple of quotes that come from the communities, which I found very interesting and which would probably help set in the context of my sharing over the next few minutes. I quote from a self-help group leader from Jaisalmer, an elderly woman, who says, this is of course translated in English, for centuries we have been dealing with the droughts. What has helped to deal with droughts is our solidarity, the sense of community. We stand together, we sit and talk together, we share our sorrows and the resources that we have. This disease has taken away the biggest defense from us, the sense of being community. We want to follow the distancing norms because we want to be protected, but we also need to find new ways of being together, which we cannot be. Another quote from Barmaid, from an elderly village development committee member. We keep hearing about the disease, the numbers, which is spreading. We don't know in our community who's ill and who's not, because we are very far from the testing facilities. What we are seeing is increasing poverty and hunger every day. And for that, we don't need any tests. We can clearly see that. So this is what is happening in the Thar Desert. As I said, it's a big area. About 25 million people live in the Thar Desert, out of which 20 million live in the rural areas, which are remote, disconnected, and those are the people who are facing the worst possible consequences of this pandemic. I would partition my thoughts in three areas, which are related to livelihood consequences of COVID-19.
Yeah.
And some of that will echo with what Pallavi was sharing, because the characteristics of Rajasthan are quite similar to Gujarat. The first one is about the migrant laborers crisis and their issues. We have some 1.4 million migrant laborers either coming back to Rajasthan or leaving the state, going back to their states. And both inbound laborers and outbound laborers had to face severe hardships, as has been the case all over the country. But one of the most striking things is that all inbound laborers are almost all of them are from the rural areas of Rajasthan, whereas all outbound laborers leaving from Rajasthan were from cities and urban areas. So the outbound migrants were stranded for long periods in shelters in cities, which are usually crowded. So they had big problems of food insecurity, of distancing, of hygiene, of healthcare access. And similarly, the people who came back, they were stranded in cities for some time to health screening to take place and to find transportation, which was disrupted for a long time. But then eventually when they reached their homes, they were literally cashless with no money. And they faced the fear, the stigma from their own families, from their own communities, in addition to the burdens of, economic needs of the families, which are linked with their wages, which they lost. So overall, it was a very difficult scenario for the migrant laborers, both incoming and leaving Rajasthan. A second aspect that came to our attention was this whole dwindling options for local livelihood generation. In a drought-prone area like Rajasthan, there are usually two large components to local rural economy, one being agriculture and the other one being animal husbandry. both extremely disrupted. And Rajasthan and the Thar Desert is basically one crop season, one crop area. Depends on the Kharif, the monsoon crop. There are usually no second crops in the area because of the rainfall issues. So the hopes were really high in the Kharif season, which is usually between July, August to November, December. Unfortunately, this year was not very bad in terms of rainfall. It was a decent year in terms of the rains that came. But then the problems were there in the context of finding seeds, pesticides, manure, and other materials that are required for the farming. So we fear.
This must have caused a lot of angst, of course. And how did I mean, you were really in the center of it all, Dr. Prakash. You were there. And as terms of mitigation, or in terms of how does recovery even begin from a place like that? Because there's just income gaps, right? There's also health scares. There's lack of addressing any human needs. And then in that environment, how did you or GRAVIS really, address this?
We began in the beginning of the lockdown restrictions in the month of March. And what we were able to do is to do a rapid needs assessment, RNA, of the local communities, which helped us in understanding what are the acute needs and how do we move forward in terms of a long-term rehabilitation interventions. 3 areas that we really looked into. One was immediate relief supplies to the families which are extremely disconnected in very far-flung areas. I did mention earlier in my talk that the Thar Desert is an area which is very, very scattered, very, very widespread.
Yeah.
And what was happening really was that all the relief supplies, including the educational messages and the testing facilities, were confined to either urban areas or to the villages which were in the proximity of the bigger cities or towns. We targeted at the villages, at the communities, at the areas which were very remote, which were very disconnected. So the first part of our work between March, April to May, June was to make family kits available to these families, which was food, dry food, and hygiene supplies. A second part of our mitigation approach was to look at the farming season, about which I was discussing recently, and to ensure that the smallest farmers, the neediest farmers who live in great poverty, would have the water supplies required for farming, seed, manure, and pesticides. So on that also we did some work. And the third aspect of our work was around the healthcare need, not only focused on COVID-19, which itself is a health problem, but other existing conditions which require, primary and secondary level medical care. So in doing all of this, we were able to reach out to about 150,000 members of human population.
That's incredible.
As well as about 500,000 livestock population.
That's just incredible, Dr. Prakash. The problem itself, what you've been able to do, and given your context again, it adds the complexity that you have had to deal with while you were figuring that out. I think that's quite incredible. And if I may just also with this thought move to the other side, really. I mean, from Rajasthan, I would actually move to West Bengal, in Chobis Pargana, where Nishtha operates. And Chobis Pargana is one of the largest districts in West Bengal. And the realities of that part of India are probably unknown to many people. For our listeners, I'm just going to provide a little context. This is an area, because of the way it's placed, highly prone to cyclones, but still suffering from water availability because of limited sweet water that is available. And COVID was a huge blow. But over COVID, they also saw Amphan cyclone that caused incredible devastation. In some pockets of Chobis Pargana, there was not a tree, remaining. Houses were flattened. People lost not only their incomes in this time, but have also lost in wealth and basic shelter over their heads. And in this highly vulnerable area, there is an additional layer of vulnerability that women face. Incredible amount of violence against women and also being prone to be trafficked. We understood and heard from Nishtha a couple of years ago now. We've been interacting with them. It is one of the hardest work that we have seen, and Mina Di here is representing how it was from that angle. From there. And Mina Di, I want to quickly ask you, because we are also running out of time, but in this disastrous lockdown phase, there it is very difficult what has happened. Can you tell us from your lens what Nishtha saw and how it worked out?
Actually, this disastrous lockdown phase has taken a toll since the end of March on the livelihood of the rural people of West Bengal. Almost 1 out of 6 people in West Bengal have lost their job. Now they have no income, they are penniless. COVID and Amphan cyclone have brought terrible condition in the rural areas. People have not only lost their agricultural land, but their production also. And they have lost their, you have told also, they have lost their houses. They have lost their belongings as clothing, beddings, educational materials of children, and kitchen utensils, everything they lost. Almost 10 million people in eastern India suffers a lot due to Amphan, whereas 2.5 million people of the South 24 Parganas only from our district in West Bengal are the worst sufferers. More than, we know everybody that women have a huge contribution in rural economy. More than 85% women are engaged in agriculture and allied sectors like livestock rearing, fishing, horticulture, etc. But they are deprived all sorts of resources and has been always seen and treated as an invisible labor forces. During this lockdown, the violence against women and girl children has increased in manifold, but it drastically surged after the destruction of super cyclone Amphan. It has been also officially acknowledged in the official sites of West Bengal Commission for Women and Childline, etc. And but our women, the girls group leaders and women's group leaders, they came forward to shape their community, shape their family, shape their husband and their nature. Actually, I have told you that women have a huge contribution in the rural economy. So we have to create facilities, create income opportunities for the huge number of women. Otherwise, we cannot save our community, especially the women and girl children. For this reason, it is important to revive their former livelihood investments like agriculture, horticulture, etc. And we are working with these women groups. We have a strong network of women and girls, and we have very strong leader of this. And they are the real backbone of Nishtha. We are
Mina Di, what you're saying is that the women who usually are facing the most trauma, they are facing violence as well as threat of trafficking, are the strongest pillar, and they are playing a huge role in the building of communities, whether it is getting Narega or whether it is the tube wells and access to sweet water. That's what you've been saying, right?
I want to say that I want to share a very successful case study here that we want to create this opportunity for a huge number of women. We have to. For this reason, women came up with a well-knit plan to solve this perennial problem of irrigation. And they mobilized the whole community, sharecroppers, landowners, farmers, and the officers of local administration. Their concerted efforts reached to the higher officials of state government. The
Understood.
work has been started.
No.
And the more than 2,500 women will be benefited from this, as after completion of this work, they will be able to cultivate 3 to 4 times in this land, in this monocrop land. Not only that, if we replicate this model in different parts of our state and our district, hundreds and hundreds of farmers will be benefited. It is really
That is so nice to hear, Minadi. That is brilliant to hear. It's a very good thing because we understood we understand. We've been hearing from you all through the cyclone and after that as well on how bad the situation is, and now to hear that there are concerted efforts and women are playing a strong role there is extremely good. And for everyone who is logged on and who's listening here, this is the diversity that we wanted to also bring out. India is a land of unity in diversity, where we have many languages, religions, food, and cultures, one community. If we view any event and the catastrophe with a single lens, we exclude millions in pain. So remembering the context while understanding problems of working people and daily wage earners, it's a consciousness that we have to develop while we think of solutions and we even appreciate solutions. My heartfelt gratitude to all the 3 friends who have joined here, Pallavi, Dr. Prakash, Minadi. Thank you very much for spending time with us, for bringing your stories to us here. Thank you very much.